This clinic in Hamburg is open to everyone, including people who have no health insurance. Official numbers show that around 70,000 people in Germany are uninsured, and the real number may even be higher. So in a country that's known for its universal healthcare, how do these people get medical treatment? Germany has one of the world's most expensive healthcare systems. But the quality doesn't always match the price tag. Costs are rising, waiting times are getting longer, many clinics are understaffed. At the same time, many hospital beds remain underused, and bureaucracy is inefficient.
We pay for a Mercedes, but we drive a Golf. We are really in a relatively bad situation, which I haven't seen for many decades.
Also da ich auch demnächst Patient sein werde und ich mit einigen Monaten Wartezeit zurecht kämpfen habe, würde ich sagen, dass das System überlastet ist.
The system needs reform. The German Hospital Association has even called 2026 a Schicksalsjahr, a make or break year for the healthcare system. And the government is promising to implement a major healthcare reform. Health Minister Nina Waken didn't sugarcoat it.
Wir haben es hier zu tun mit
We're dealing with inefficient structures, unsustainable financing, staff shortages, poor digitalization, and way too much bureaucracy.
Digitalisierung mit einem Übermaß an Bürokratie.
So what exactly is going wrong, and what are possible ideas for solutions? Germany has the most expensive healthcare system in the EU. In 2023, the country spent around 12% of its GDP for healthcare, more than any other country in the European Union. However, in terms of avoidable deaths, its performance is just average. In Germany, more than 83 deaths out of 100,000 inhabitants were considered avoidable. In Sweden and the Netherlands, it was less than 60 deaths.
Already 25 years ago, the WHO produced a first international ranking where we at that time were third in expenditures, but 21st or 22nd in outcomes. And at that time, the then chairperson of the academic advisory board to the ministry made his famous sentence, "We pay for a Mercedes, but we drive a Golf" in healthcare. And I think that's actually true.
But what makes it so expensive and so inefficient? Here are some of the common talking points. An increasingly aging population, an inefficient system of hospitals and clinics with too many beds and low occupancy, many unnecessary doctor visits and treatments, often done in hospitals instead of an outpatient basis, rising costs for medications and treatments, and broad healthcare coverage and benefit packages. We'll come back to that in a moment. But what do these rising costs actually mean for the average person and for the economy as a whole? To answer that, we first need to understand how Germany's healthcare system is funded in the first place. Most people, nearly 75 million, are covered by public insurance. Half of health insurance contributions are financed by employers and half by employees. These contributions have risen steadily in recent years. In 2026, an average of 70.5% of gross wages will go toward health insurance, regardless of your health status or age. This applies to everyone with statutory health insurance. Uniquely in Germany, you can completely opt out of the system. Around 8.8% of people in Germany have private insurance, mainly high-income earners, the self-employed, and freelancers, which drains financial resources from the statutory system and contributes to the problem. The insurers' expenses continue to rise, while their revenues decline. In 2026, insurers face a €2 billion shortfall. By 2027, that gap could explode to 12 billion. One more reason for that, the demographic change.
The number of patients and the percentage of patients above 70, above 80 years old will considerably increase, and that is putting additional pressures on the expenditure side.
Germany has one of the highest amounts of hospitals per capita in Europe. This ensures good access to care, but also creates significant inefficiencies.
We have among the highest numbers of beds per 10,000 patients, and we are using these beds extensively. In international comparisons, it's demonstrated in many areas that we do treat patients within a full hospital stay, where other countries far more common do it without a hospital stay in the ambulatory setting.
And the costs for this care are increasing. With new breakthrough treatments on the horizon, the system is under even more pressure.
At the same time, we see that in the drug industry, in the medical device industry, there is a lot of progress being offered. Yeah, I mean, if you look at Alzheimer, if you look at cardiovascular diseases, there are some breakthrough therapies approaching. But then the question is, can we afford to be as generous as in the past to really fund all these therapies?
Another cost driver, Germans go to the doctor quite often. According to an OECD poll, Germans in 2023 went to the doctor 9.7 times on average. This is more than the OECD average of 6.5.
I think there is an overuse because people are used to go to the physicians very regularly and very often. It's also an incentive aspect from the provider side, because the remuneration system, the fee schedule for physicians rewards that people come back. Yeah, you fill your offices regularly by inviting them to come back. That's a part of the business model of physicians.
And this leads to long waiting lines. On average, the waiting time for an appointment with a specialist in Germany is 36 days. This is one of the things bothering people with statutory health insurance the most.
Facharzttermine sind schwieriger, wenn man nicht privat versichert ist. Hautarzt ist schwierig.
Erstmal die längeren Wartezeiten und dann versuchen Sie mal telefonisch bei irgendeinem Arzt, bei vielen Ärzten, sage ich mal so, einen Termin zu bekommen. Die gehen gar nicht erst ran.
Thema deutsches Gesundheitssystem. Wie zufrieden sind Sie denn? Was ist die Lage?
Also da ich auch demnächst Patient sein werde und ich mit einigen Monaten Wartezeit zurecht kämpfen habe, würde ich sagen, dass das System überlastet ist.
For some people, the problem isn't the waiting time. It's getting any treatment at all. There are people who have no insurance coverage whatsoever.
Always, if the economy is in a crisis, then the number of people without health insurance is increasing as well, because then you are falling out of the labor market, you may fall out of your flat, and then the likelihood that you lose your health insurance is there, and it's an increasing problem. People can come back, of course, but then the health insurance system wants them to pay also the lost contributions of the time when they were not in health insurance, which of course is not an invitation to come back.
So what can these people do when they get sick? Let's take a closer look. This clinic in Hamburg is open to everyone, including people who have no health insurance. Official numbers show that around 70,000 people in Germany are uninsured, and the real number may even be higher. So in a country that's known for its universal healthcare, how do these people get medical treatment? Let's take a look inside. Bronwyn Margolis is managing this free clinic that treats uninsured patients, people who have fallen through the cracks of the healthcare system.
Es kommen Männer,
We see men, women and children.
Kinder, Menschen, die auf die
People
Straße
living on the
leben,
streets
Menschen, die
and people without a secure residency status.
Aufenthaltsstatus haben.
Being uninsured is rarely an isolated problem. It often goes hand in hand with uncertain residency status or unstable work. They don't have health insurance because, for example, they can't get work, at least not jobs that come with social insurance. There are also many day laborers who can only work a few hours here and there. Those jobs offer no protection either.
Und dann natürlich die Familie.
And of course, their families are affected as well, their children too.
Kinder sind auch mit betroffen.
By offering multiple types of consultations, the clinic aims to address as many concerns of their patients as possible.
Jeden Dienstag.
We offer general medical consultations, twice a month a gynecology clinic and once a month a pediatric clinic. We also provide social counseling.
Beratung an.
These sessions address social issues and help patients find a way into the system. Today's doctor on shift is Matthias Plininger, who ran his own practice for decades. Now, at 80, he's retired but still volunteers here. Like many other patients, this woman doesn't want to appear on camera, fearing consequences or stigma. Her symptoms began 2 weeks ago.
It's pain me, and my hair pain me, and my head pain me.
During his shifts, Plininger encounters the full spectrum, from minor infections to cancer diagnosed in late stages. We see this often. People come in with untreated illnesses because they simply had no way to see a doctor. Or if they could, it would have cost them far too much. To Matthias Plieninger, helping here is a responsibility and a matter of principle. I find it unacceptable that in a wealthy country like ours, people are simply left behind, and when they fall ill, they have no protection. That urgently needs to change. Access to healthcare is a human right, and it must be upheld. Around 70% of patients come regularly. This man has been coming for almost 10 years. He speaks little German, so they communicate via an app. 1/7/2017, yes. In Germany, yes. In severe cases, or when a specialist is needed, the clinic reaches its limits. That's when a network of doctors steps in. Or clearing centers, places that help patients navigate the system, take over. But sometimes even that doesn't help, leaving Margolis with a heavy heart. I always leave the consultation with mixed feelings. On the one hand, there are beautiful encounters, moments when we can actually help people. But on the other hand, I wish they had access to much better care, that they could just seek medical help like anyone else, instead of having to wait until our next Tuesday clinic. Health insurance in Germany has been mandatory since 2009. Yet many people still fall through the cracks. And until this changes, initiatives like this continue to fill the gap.
The official numbers are totally underestimating the real problem. Experts estimate that we probably have between 500,000 and 1 million people without health insurance coverage.
But back to those with insurance. Many feel the daily strain of rising costs and endless waiting lists. We can see that in this survey from 2025. Over 30% of respondents said that they were no longer satisfied with the healthcare system. In 2021, this figure was only 10%. So the big question is, what's being done about it? The German government has set up a commission to draft a reform plan with results expected in March. The main goal, to stop insurance premiums from rising further. Politicians are debating about how to do that. Either cut costs on the services or find the money from elsewhere. But in reality, there's no one-size-fits-all solution.
I think there are several reform steps which we really must take. One is making hospitals more efficient, which means centralizing the hospital structures and making sure that hospitals only treat those patients where they have a high expertise. At the same time, we must reduce the capacities of hospitals. And this means that we also must increase further the incentives to do ambulatory treatment instead of inpatient hospital treatment. The second thing, I think, is we must increase the use of digital tools systematically. The third thing, I think, in ambulatory care, we have too much a focus on the physician. I also think we must be critical on the benefit package. We do have of health insurance. We do have the broadest benefit package in Europe.
But any reform takes time, and the pressure is growing. Germany's healthcare system is still strong, but for how long? The question now is whether Germany can reform in time before the cracks become serious fractures.